From the first whisper that Robert F. Kennedy Jr. could become America's top health official, questions started flying.
Do we know how RFK Jr. is expected to reform Health and Human Services?
What would Kennedy actually do as Secretary of HHS?
His nomination has drawn criticism from a host of public health leaders.
He's a vocal critic of vaccines.
There were some questions about Kennedy's stance on vaccines, like the
and
polio
agencies that regulate our drugs and food supply.
Including about what millions of Americans eat and drink each day.
Months went by with more speculation than clear answers. Now, 8 weeks into Kennedy's tenure at HHS, we're getting answers, and they're coming fast. Today, we take stock of Kennedy's first decisions at HHS and explore how they are transforming health in America. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. We're talking today about RFK Jr.'s early weeks as HHS Secretary. He's made big changes. We will start with jobs and spending. Kennedy has cut both across HHS. Producer Melanie Evans has been working to keep tabs on the scope of what's happening. Hi, Melanie. How's it going?
Dan, I am trying to keep up, but the cuts Kennedy has made have been sprawling. Here's what I can safely say. Kennedy has embraced the Trump White House ethos of sweeping, blunt, abrupt changes. You spoke last week to Julie Rovner from KFF Health News about Kennedy's restructuring of HHS. I think she used the word sledgehammer.
She did more than once. And Melanie, as you know, last week, HHS laid off some 10,000 people, closed regional offices, and eliminated entire departments. Kennedy said he is streamlining the agency, saving $1.8 billion a year without sacrificing essential services like Medicare and Medicaid. But we know Kennedy is doing more than handing out pink slips.
That's right. HHS has also canceled more than $11 billion in funding to states. This is money they were using to fight disease outbreaks, prepare for emergencies, and treat mental illness and substance abuse. This is money Congress set aside during the pandemic to help with the response. State and local governments still had time to spend that money. HHS instead abruptly rescinded the funding, saying, the pandemic is over. It was out of the blue, and it left public health agencies with no time to plan for the fallout, like at the Dallas County Health and Human Services Department.
No preparation, no advance warning. This particular grant that we received directly was rescinded effective the day before, so it's like done. It's like a done deal.
That's Dr. Phil Huang, who runs the department. He found out his grant had disappeared on a Tuesday morning around 6 a.m. by email. Phil quickly started trying to figure out what was going on.
And I was a little uncertain about it, and I think I forwarded it to some other people. I said, what is this?
He texted people he knows in Texas government. He emailed health directors in other states, and he soon realized that one grant was not the end of it.
And it started to trickle in that this is happening, it is what's happening across the country.
Ultimately, Dallas County lost federal funding from 3 canceled grants. The agency immediately laid off staff, 21 people. Dan, they mostly worked in disease control. This includes epidemiologists and immunization staff.
Wait, Texas is at the center of a growing measles outbreak. 2 children have died. The latest number of infections is now 505. At least 57 have been hospitalized. Nearly all are unvaccinated.
Yes, and Phil has been making a push to boost vaccinations in kids.
I contacted all of the superintendents for all of the public school districts in Dallas County, and then also all the superintendents for the private school districts that had low vaccination rates, as well as all the daycare centers.
He signed a letter about vaccinations to schools to hand out to parents, and he offered to bring pop-up vaccine clinics to schools.
Well, how's Phil going to do that now?
He can't.
We're having to tell them we don't have now the staff to be able to do what we were talking about doing.
Dan, what's happening in Dallas County is happening across the country. The HHS grants that were canceled flow to local health departments, sometimes directly, sometimes through states. States also relied on funding. The money went to salaries for epidemiologists, lab technicians, technology staff. It paid for new equipment to upgrade diagnostic laboratories, and it went to subcontractors to help states prepare for emergencies.
So as Phil described, Melanie, with the money gone, I'm assuming that means so are the jobs and the services?
Well, people are trying to figure out how to keep some programs going, but the financial hit is just too big to avoid losing some staff and services. An organization that represents 35 of the biggest cities in the country said their members lost more than $500 million. Utah has cut 37 jobs. Maine let 40 people go. North Carolina said it lost funding for more than 80 jobs, including epidemiologists, to help with disease control.
It's been intense because on the other end of these are my neighbors and members of our community. Like, government workers are people in our community who also deeply care about our communities and serve them.
That's Ryan Jury. He's North Carolina's acting senior deputy for the Division of Public Health. North Carolina lost an estimated $230 million when HHS canceled the grants on March 25th. Ryan's been kind of shell-shocked.
It's just been a really intense couple of days, weeks, and lots of long hours. And I've lost track of what the days are in the week, to be honest.
So Ryan in North Carolina and Phil in Dallas are reeling from what seems like a lack of forethought in the cuts. Overnight, they are racing to plug gaps. Gaps like North Carolina's ability to investigate disease outbreaks, Dan. In the wake of all of this, people are just kind of baffled and really worried. Chrissie Juliano at the Big Cities Health Coalition summed it up best for me.
I do not think anyone expected the dismantling of the federal public health infrastructure to be so dramatic and so quick and so haphazard. And I think that it's going to cost lives. It's going to cost real money.
It's important to say, Dan, that Chrissie and others told me that agencies should always look for ways to improve efficiency. They don't object to a reorganization, but what they're seeing is more chaotic.
This is not just a routine reorganization to be more efficient. Like, this is the least efficient thing that is happening in Washington.
The day I spoke with Chrissie, a judge temporarily froze action by HHS after 23 states sued to keep the funding.
Melanie, we've been talking about roughly $11 billion that HHS canceled to states at the end of March. It strikes me that these aren't the only HHS grants to be abruptly cut off, right?
That's right, Dan. Budgets across HHS under Kennedy are also part of the Trump White House's broader agenda to terminate federal spending for diversity, equity, and inclusion efforts, and more broadly, to shrink the budget. So that's led to canceled grants and contracts under the National Institutes of Health.
Yeah, a few weeks ago, we did a show where two researchers at Johns Hopkins were talking about the uncertainty and fear they have about their work being shut down. When we come back, we look at where Kennedy has made moves in two closely watched areas of health policy: food and vaccines. Welcome back. We're taking stock of RFK Jr.'s early decisions as secretary. Kennedy is moving quickly to remake HHS. He's laid off and pushed out experts across agencies, closed departments, and cut spending. But he has also made moves on another front: policy. Kennedy has taken some early steps on food and vaccine policy. These are two areas where Kennedy's personal views raise questions about his priorities. Melanie is back to walk us through it all. Hey, Melanie.
Hey, Dan.
So let's start with food, perhaps the one area where RFK Jr. has pretty wide support, right?
Yes, he's gone after processed foods and food additives as contributors to poor health.
Now, this is core to Make America Healthy Again, that movement, taking on food production and nutrition to go after chronic disease.
Yes, and he has moved very quickly on this front. Kennedy last month directed the FDA to explore ways to close a regulatory loophole for substances in food. Emily Leib at Harvard University explained to me, companies can include a substance now if the companies say it's safe.
There are a lot of things being used in food that it's very hard to know what they are, for both because the company hasn't ever told FDA and because some of them, depending on what they are, may or may not really have to be mentioned on the label even.
Emily told me she's hopeful Kennedy will tighten this loophole. The next step could be a proposed rule, Dan.
Okay, so he's pushing ahead on food policy. This is the one area where Kennedy's views are welcomed by pretty much everyone apart from big food, right? The industry. Now, Melanie, vaccines. Kennedy's long history of vaccine skepticism prompted a lot of people to wonder what policies he may go after. What has he done there? What's that accounting?
Dan, Reuters and other news outlets reported HHS under Kennedy is planning a large study of vaccines and autism.
Let me pause you for a second here, Melanie. It's important to say that many prior studies have debunked the idea that vaccines cause autism, though Kennedy has repeatedly linked them.
Correct. Kennedy's new study is being criticized as irresponsible by scientists and autism groups for that very reason.
The country's deadly measles outbreak is getting worse.
So is his response to the measles outbreak underway in Texas.
Health Secretary Robert F. Kennedy Jr. is expected to travel to Texas today, where there have been nearly 500 cases since January.
57 of those patients have been hospitalized, and we know now there have been 2 fatalities.
Dr. Tom Frieden ran the CDC for 8 years, including during a measles outbreak.
When there's a measles outbreak, there's a tried and true way of stopping it. You increase vaccination rates, you engage with communities, you listen to what the concerns are, you promote vaccination among those at risk.
Tom and others have come down hard on Kennedy for his public response to what's happening in Texas, like a comment he made at a cabinet meeting in February.
It's not unusual. We have measles outbreaks every year.
As cases have climbed, Dan, public health and infectious disease experts have wanted to hear from Kennedy what they want to hear from any HHS secretary, an urgent call to slow the outbreak through vaccination. Instead, he's made comments like this, speaking on Fox News with Sean Hannity.
We should have transparency. We should have informed choice. There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information and encourage them to vaccinate. The vaccine does stop the spread of the disease.
I want everyone to just hear.
I mean, Melanie, he acknowledges that the vaccine helps, but that's anything but urgent.
More than that, his comments are misleading. The vaccine is safe. Kennedy left out some essential context. There are no deaths from the vaccine in healthy people. Rare cases of death from side effects have occurred in immunocompromised children. Dan, the vaccine is not recommended for these children.
Now, a second child has died in the outbreak, and this weekend, Kennedy did say the vaccine is the most effective way to stop infections from spreading.
Yes, and Tom Frieden, an infectious disease specialist, said they welcomed Kennedy's comment. Tom still sees a real risk to public trust in vaccines from Kennedy's earlier actions.
We've seen very misguided discussion of cod liver oil and steroids and antibiotics. These are not ways to prevent measles. The only effective way to protect people from measles is with vaccination.
This really speaks to maybe the biggest question many had about Kennedy in the role of HHS secretary. People wondered how he would use his role to influence public opinion on vaccination.
Over the weekend, Republican Senator Bill Cassidy from Louisiana went on social media to say everyone should be vaccinated. Those were his exact words. Cassidy also said top health officials should be clear on this before another child dies.
Melanie, that seems like a comment aimed right at Kennedy.
Public health advocates are closely watching RFK Jr. right now, Dan. There's a lot of concern over what he's doing related to the CDC's Advisory Committee on Immunization Practices.
Sure, we talked in January about this obscure committee, the ACIP. Its members are typically clinicians and scientists, and they evaluate and recommend who should get vaccinated.
Right. And a lot of people trust and follow those recommendations, including doctors and states, and typically the CDC, not Kennedy. He's criticized many committee members as being beholden to pharmaceutical companies.
Yeah, I mean, in early March, the CDC launched a new website that lists the conflicts of interest disclosed by current and former ACIP members.
Yes, Kennedy often describes the committee as compromised. He has also said he wants to root out conflicts. Dan, let me be clear. The ACIP already requires members to declare conflicts and recuse themselves from votes. Tom sees this as a move to delegitimize the credibility of the committee.
For RFK Jr. to say that the ACIP is severely conflicted is false, and it undermines our confidence in vaccine recommendations.
I spoke with some people whose names are listed on that website, and they agreed with Tom. The ACIP, for years, has operated in the public eye with a clear policy on conflicts of interest. They do all of this to build trust in their decisions.
So where is this headed, Melanie?
Well, as secretary, he's got the power to make fundamental changes to the ACIP. He can remove and name members to the committee at will. He has not taken any steps like that. The first public meeting of ACIP is later this month, in April. I know people are going to be watching for any sign of his approach to vaccines.
So at the top of the show, right, we talked about all of these questions about what MAHA would look like. Melanie, with vaccines in particular, as you know, many have worried we'll see a full-scale assault. Is that where this is headed?
It's hard to say, Dan, what will happen next with vaccine policy. But I do believe we will know soon. One of the things that's been clear as I've covered Kennedy these last 5 months is that when it comes to his priorities, he doesn't hold back.
Melanie Evans, thanks so much for your reporting on this.
You're welcome, Dan.
I'm Dan Gorenstein. This is Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us, the NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producers Melanie Evans and Ryan Levy, editor Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, with help from Kate Seepy, Cedric Wilson, and Colleen Schenk, sound designer Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Additional thanks to Sarah Rosenbaum and Paul Hunter. Thanks also to all our listeners who helped to support our work, including Kelly Osmondson, William Bogue, Alika Gurel, Andy Fitz, and Jana Jones. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.